Hi, my name is Dr. Erica.
And I'm Joy, and we are from Inspired Dental Wellness.
And today we're going to talk about cone beams and your airway.
The technical name for a cone beam is cone beam computed tomography, which is a really long word. So we call it either a CBCT or a cone beam. Basically what that is a 3D x-ray that we take from pretty much your neck all the way up to the top of your skull. And it gives us a really good look at what's going on at the structure inside where we can't see what's happening.
So some of the things that we're looking at are your nasal cavity. So we're looking at your septum, your nasal septum. We are also looking at the width of your dental arches, so about both your top arch and your bottom arch. And we're also looking at your airway, so the space behind your dental arches. Is that nice and wide, or is it really, really narrow? Are there things like your tonsils and adenoids obstructing that? So we take a look at all of those things when we're taking that scan.
This scan is really important for a lot of our different patient populations that we work on here at Inspired Dental Wellness. So we take a CBCT on all of our frenectomy patients, on all of our orthodontic patients, and on all of our TMD patients.
Depending on what we find on those scans is really going to determine what we're going to be doing with our treatment. So it kind of determines where we're going to start with treatment, where we need to go with treatment. So if we don't have enough space in an airway and we want to make sure that we can breathe really well through our nose, we have to take a look at all of those things. So if we have a deviated septum, we really need to take care of that. So then you would be referred to the ENT to have that evaluated, because we can't do everything that we need to do if you're not able to breathe through your nose.
That being said, with myofunctional therapy, one of the big goals with myofunctional therapy is to be able to breathe through your nose. So in therapy, we teach you to hold your tongue up to the roof of your mouth. Your tongue should stay on your palate at all times. So if you cannot breathe through your nose because of a structural obstruction, then myofunctional therapy is not going to work for you until you get that obstruction removed so you can breathe through your nose, and then we'll be able to be successful with myofunctional therapy.
People that come in for treatment of TMD or TMJ pain or TMJ issues, like pain in your jaw, we're taking the cone beam so that we can look at the position of the jaw joints, and we're also looking at what the bone of the jaw joint looks like. So a lot of times the position of the jaw is going to be pushed back quite a bit. So that's because your teeth are forcing your jaw backwards every single time you're biting down, which over time we're going to actually see most likely bony changes in the jaw joint itself. So the bone will start to erode, and we'll see those bony changes on those scans. So if we see early signs of that or even late signs, we could go ahead and address that and start treating it.
The big reason we do cone beams and why they're so important in a treatment plan for frenectomy is because we're able to zero in on what your airway looks like. Your airway is a very mysterious thing because it's just a negative empty space between your structure. So your airway is formed by where your spine sits, which cannot move, and your jaws, which can move. So if your jaws sit too far back and too close to your spine, your airway space is going to be very small and narrow. And that's one of the goals with the orthodontics that we do here in the office. We're able to move your jaws forward away from your spine so it opens up that airway space so you can breathe and sleep better. What happens if someone wants to do a frenectomy procedure and you haven't had a CBCT? What are the downfalls of not having a full comprehensive evaluation ahead of time? If you don't have enough room in your airway and it's very small and narrow and you get a tongue tie release, your sleep and breathing can actually get worse because now your tongue is not going to have anywhere to go and it's going to take up space back in your airway. So not every provider is as comprehensive as we are with our evaluation of not only what your tongue tie looks like, but what your actual structure looks like to make sure you'll be able to have a successful outcome with a frenectomy procedure.
So if you're considering having a frenectomy done or frenuloplasty, or you're having orthodontic issues and considering doing braces, or having even TMJ issues, come to Inspired Dental Wellness, where we will give you a really comprehensive treatment plan and really figure out what the root cause of the problem is.